Hi, my name is Dr. Cozy. I see we have you here today due to an allergic reaction. Oh yeah, I can see. You're pretty broken out. Okay. Are you having any trouble breathing at all? Let's take a look in your throat really quickly, okay? So open. Beautiful. Just making sure that we don't see any kind of swelling that might cause problems with the airway. Take a look inside of your mouth and your cheeks. Okay. Then just lift up your tongue. Excuse me, my stomach. Right. Just going to take a look here at your skin. So this is covering your face. Goes down your neck. Chest. Arms, okay. Is it itchy? Just trying to feel the texture, make sure there's no what we call weeping or drainage of the skin. Gonna stand over you for just a moment. Okay. It doesn't look like it's extending into the scalp. Let's just do the face, neck, chest, and shoulders and arms. Okay. Just going to feel the skin temperature with the backs of my hands here. It is a bit warm to the touch. Okay. Any tenderness? Okay. normal range. I just needed to do a quick check just to make sure that there's no sign of any acute symptom that would require us to act urgently, okay? Especially in regards to your airway, because if there's any sign of swelling within the throat, within the mouth, that can block your airway, and then we definitely need to get on that. But I'm not seeing anything like that. Okay, I'm just looking at your chart here. Okay. So you do have known drug allergies to sulfa and metronidazole, correct? Okay. Were you in contact with either of those substances? Okay. What are the reactions when you do come into contact with them? Okay. That's common with sulfa drugs, yeah. Okay. Do you have any history of allergies with food or any kind of skincare products, pollen? Not that you know of, okay. So hives and eye swelling are the known reactions that you have to those two medications, okay. Have you started any new medications within the last few days? Okay. How about any new skincare, shampoo, laundry detergent, any new makeup? Okay. There are definitely, especially preservative ingredients in different makeup products that can cause an allergic reaction. That's quite common, so we're going to test for those. Have you been experiencing any kind of nausea or vomiting? Okay. How about any dizziness? Shortness of breath or trouble breathing? Any lightheadedness, fainting, confusion? Okay. And we know that you're experiencing some hives, rash. Given the location of the rash on the face, then extending down the neck, the chest, a little bit on the shoulders, it does track for it to be that new foundation that you're trying. Let me take a look here at some previous notes from your previous visits. Have you had any allergy testing done in the past? I'm not seeing anything in your chart. You're not sure? Okay, that's fine. We're going to be doing some allergy testing together today, okay? Given the extent of the hives, how angry and red they're looking, I think it's important to do that. just making sure, because that way if you've had one in the past, we have something to compare it to, and also I can see what was tested. But it's also common that as we age, our bodies change, and sometimes we can develop allergies. I used to be allergic to shrimp and oil crustaceans, anything with a shell. And then after I got pregnant, all of a sudden I could eat those foods just fine. Like, what? And, these things happen. Our bodies can be very mysterious sometimes. So, okay, I'm gonna do a little more of an exam. Let's get a new otoscope cover because this one is old. Gonna have a look inside your ears real quick here. Gonna feel me in gently pulling your ears back so I can get a good look inside. Okay. Your ears look good. I'm not seeing any sort of internal redness or inflammation. Just looking on the outside of the ear. Take the other side. Okay. Gonna feel me pulling your ear back on this side now. This is okay. Is there any tenderness or? Okay, good. I'm not seeing any redness or inflammation on this side either. Take a look at the external. Little bit of redness is expanding behind this ear. And we're just gonna take a peek right inside of your nostrils, okay? Just checking. Good. Nostrils look fine. Okay. Open your eyes for me, real wide. Just look straight ahead. Are you feeling any kind of burning in your eyes? Look up. Okay, good. I'm gonna pull your eyelid just gently up. Gonna have you look down. Okay. Other side. And if you can just close your eyes for me really quickly. Thank you. I just need to feel the lid. The lids. Just feeling for any swelling. Okay, you can open. So, what we're going to do is some intradermal testing, which means I'm going to be using very, very, very tiny little needles, okay? They're tiny. That are going to inject a little amount of common allergies, particularly those found in cosmetic products, okay? I know it sounds really scary, and I promise you we'll go very slow, alright? Make sure that you are feeling comfortable with every step of the process. If it makes you feel more comfortable, you can look away. I can get you something to squeeze if you need, whatever you need to get through it. But most people, once we actually get started, it's not quite as bad as they thought it would be. These needles are tiny, so you'll feel a little prick, but it's not going to be painful. It's not like getting a shot at all. Okay? You can do this. I promise you can do this. I don't like needles either, and I've been through quite a few tests, and one of the things that helps me is to do my 5 senses. So I will look around the room at 5 different things that I can see, listen for like 4 different things that I can hear, 3 different things that I can touch, 2 that I can smell. I don't really do taste, that would be kind of weird, but that can kind of help ground me as well as distract, and I definitely recommend giving that a shot, okay? No pun intended. Okay. I promise you it'll be okay. I have done so many of these, and I know how to be very, very gentle. Promise. Okay. So I do need to set up. So let me just pull my tray over. Pardon my ancient knees. Okay. I'm gonna have you just pull your arm across for me, okay? Just like so. I know. It's kind of a stretch, but I need to be able to really see what we're doing here, okay? Okay. And I'm just gonna take a look at your arm skin here. Make sure that we have a clear field. And there's no sign of swelling or inflammation that might give us a false reading. But I'm not seeing anything. So I'm going to be labeling your arm, okay? So that way we're able to see what we've injected where. So gonna need to use a different pen. Sorry about that. Okay. So. Oh yeah. We are taught to write our zeros like that, so that way we're able to clearly distinguish if it's a 0 or an O. Alright. Alright. Sorry about that. And I guess I need another alcohol pad. I only got one for some reason. Man down. Ugh. Okay. That was still wrapped, so you can use it. Alright, dear. Sweep this on down. So now I'm going to set up my syringes. Number 1. 2. So I have these all numbered, so that way we know exactly which one is going where. So this is 6. 7. 8. 9. Alright. So we have our 10 syringes here, okay? And so each syringe is going to be injected in its corresponding number. That way we know exactly what reacts, if it does, okay? If it helps, you don't have to look, okay? If that helps you feel more comfortable. If it's more comfortable to look, then that's fine too. Some people like to know what what's going on so they know what to expect. Is there anything I can get you before we start? Okay. I promise you, okay? It's gonna be okay. If at any point you need me to pause or anything, just let me know and I'll do that for you. Okay? Okay. Alright. Move over to the side slightly. So that way both get, excuse me. Good. Alright. No big deal, right? Okay, so that was the first one, and you did great. So now, just making sure I have the eye of the needle angled upwards, and yep, it just goes right under the surface layer of the skin. Okay. Do. So number 4. Alright, and then last one on this side is number 5. You're doing great. Alright. Okay. So, how are you doing? Do you need me to take a break, or are you okay to finish? Okay, then we'll just get her done. Okey-doke. almost there. And last one. All right. You did great. Okay, so now we just have to wait a few minutes for that to potentially react, okay? If at any point you start feeling any sort of intense burning sensation, or it's becoming difficult to swallow, difficult to breathe, let me know, okay? I'm gonna be right here with you. I just need to take some notes. So you feeling? Okay, good. Oh yeah, we do have two positives here. So number 3, formaldehyde, as well as number 7, sodium hydroxymethylglycinate. Okay, so both of those are very commonly found in cosmetic products. They're preservatives. And so, just mark really quick. And it looks like those are the only 2. Yeah, those are the only 2 positives. Okay. From here on out, it's going to be very important that you check the ingredients on all of your skincare products, because a lot of them do carry both of those preservatives, but they're also both listed on labels. Okay? Okay, so real quick. Need to take a look inside of your throat again. So just open. Perfect. And just need to make sure that we don't see any redness or swelling. I'm not seeing buccal mucosa. Looks the same. Lift up your tongue. Let's have you. Actually, let me just take a look here. Sometimes my brain moves very quickly, and I think of 2 things that I want to do at the same time. Can I just get you to swallow for me? Again? One more time. Okay. Just feeling for any swelling that might be new. Can I get you to close your eyes again? Thank you. Not feeling any new inflammation or edema, swelling. Not feeling any hot spots on the skin either. Take a look in your eyes again. Not seeing any change in color or any tearing, redness. Look over here. Look over here. Keep looking. You can relax. I'm just gonna check inside your ears one more time. Don't feel me pulling your ear back slightly here so I can get a better angle with my otoscope. Okay, so I don't see any redness or swelling either here. Everything appears the same as it did before. Pulling this ear back now. Don't see anything concerning inside of this ear. Looks the same. Still a bit of redness behind the ear, but that's not looking like it's changed at all. Okay. So I'm not seeing any change on exam. Compared to how you presented when you first came in. The redness and swelling on your face, neck, and chest is looking about the same. Not seeing any change in temperature or change in the amount of inflammation, so it's really important that we note these things because generally when we have an allergic reaction, our bodies do follow the same pattern, so if something sets it off, it's good to know where to look and what to look for. Okay. So, take off my gloves here. Let me just write a quick note so that way we make sure that we have this information in your chart for the future. And it's going to be very important that you inform your primary care physician so that way they have this information as well. I will be CCing a copy of our notes to them for you. Let me just actually make sure really quickly that we have... Yeah, okay. Yeah, we have them in our system. So I'll get those sent over so that way you have your information everywhere. But it will be important to let any new clinic you go to know, any specialist you see, dermatologist especially, let them know. Okay, so I have all of my notes. So what I'm going to do when I step out of here is give orders for a nurse to start you on an IV of diphenhydramine, which is going to help and calm that rash and those hives, okay? It'll make you feel drowsy, but a lot more comfortable. And it's okay if you stay here and take a nap for a while. We are going to keep you here for observation for probably a few hours just to make sure there are no changes, that there's no sign of sudden throat swelling or anaphylaxis. Okay. I'm also going to write you a prescription for an EpiPen. So it's epinephrine that you would inject into yourself if you do start having a severe reaction to a product or food. And I'll have a nurse come in and show you how you would use that, okay? Yeah, we can just bring you one from the pharmacy and then we'll give you a prescription so that way if you need to refill it, you're able to, okay? Okay, and then I'm gonna go and fax a copy of our chart notes over to your primary care physician. And would you like to have a copy of those as well? Okay. Then when our nurse comes in to start your IV, I'll have her bring a medical release authorization form for you to sign, okay? Okay. I will be coming back in here to check on you periodically, alright? And if you need anything before Chelsea's able to come in and start the IV, there's a remote control right here for the TV. And if you look at it, you'll see a big red button that says call. That dings the nurse's station, so that way someone's able to come in and help you right away, alright? Okay. If you start feeling any kind of discomfort in your throat, any difficulty swallowing, and especially any difficulty breathing, you press that right away, okay? Okay. Do you have any questions for me? Well, like I said, I will be back in here to check on you in a little bit, so if you think of anything in the meantime, you can ask me then, okay? Okay, so you sit tight, and someone will be in here in just a few minutes. Probably Chelsea, because she's rounding down here in the emergency room today. Okay.